Pregnancy and childbirth can be a very stressful time for women, and it can have a toll on their mental health. Hi, I'm Dr. Amrita Tandon. I'm a gynecologist, obstetrician, infertility specialist, and a gynec endoscopic surgeon practicing at Dr. Sudha Tandon Hospital at Chembur and Vashi. And today I'm going to be stressing on maternal mental health. Did you know that up to 1 in 5 women will experience some form of depression during pregnancy or after delivery? Only about 15% of women suffering from maternal mental health issues will seek and receive treatment. 1 in 7 women can have depression during their pregnancy. Maternal mental health issues not only affects mothers, but it affects the whole family and also the newborn child. So it is important to talk about it and raise awareness about this issue. What causes maternal mental health issues? So a combination of biological, psychological and social stressors can lead to mental health issues during pregnancy and after delivery. Lack of support, a family history, a history of previous such issue during the pregnancy in the past, or lack of antenatal and postnatal care can lead to mental health issues in women. Good news, these can be prevented, reduced and treated in most women with good counseling and medications. So let's talk about some of the common mental health issues that we come across in mothers. So the most common one is postpartum blues or baby blues. This can be experienced by about 80% women who have just recently delivered. They usually come in about a few days after childbirth and do not last for more than a week or 2 weeks at most. This can be caused by a sudden shift in hormones, and usually the symptoms are excessive crying, sadness, irritability, mood swings. These symptoms are usually self-resolving and the women mostly recover within a few days. If these symptoms continue for more than 2 weeks, it's more likely that you're dealing with a case of postpartum depression. Perinatal depression can be experienced by about 20% of women either in pregnancy and or after delivery. The symptoms can be mild to moderate, are similar to those of clinical depression, but specific fears such as excessive preoccupation about the baby's health, inability to bond with the baby, excessive sadness, crying, overtiredness, fatigue can be a part of clinical depression which affects new mothers. Stress, including taking care of the newborn, mothers may feel very tired, irritable, angry, and may not be able to bond with their baby because of this depression. And hence, this can lead to a delay in the infant's development and a bond between the mother and the child, which is key to the growth of the baby. And hence these women should definitely seek treatment. They should talk to their healthcare providers, their doctors, their friends to avail of any sort of help that they can get, because depression is something that needs treatment and maternal mental health is extremely important and it can be treated. Up to 15% of mothers may also suffer from postpartum anxiety. This can lead to restlessness, racing heartbeat, inability to sleep, and a lot of what ifs. What if my baby suddenly develops SIDS, which is sudden infant death syndrome? What if my baby falls? What if I can't take care of my baby? So these are all anxiety symptoms, and these also can be absolutely treated with good counseling and certain medications. The other forms of maternal mental health disorders include mania, which is not very common, obsessive compulsive disorder, and psychosis. So postpartum psychosis can also affect some newborn mothers, but this affects up to 1% of mothers and it is rare. The important point about maternal mental health issues is that firstly, it can be preventable, and secondly, it can be treated. Seeking help in the form of support groups, socializing with your friends, with new mothers, just taking a walk in the park with your baby, enjoying the process of motherhood, seeking help from others whenever possible is important to prevent mental health issues and especially depression. Sometimes these women may need psychotherapy or counseling by a psychiatrist, and this also helps these women overcome a lot of mental health issues. Certain medications like SSRIs can be given to you by your doctor, and these can treat depression and anxiety issues. If you're breastfeeding and are worried about consuming certain medications, you can always talk to your doctor about what medications are safe during pregnancy as well as breastfeeding. Remember, it is very important to seek help and treatment because the baby's growth and development depends on the mother's well-being and as well as all other family members. So seeking treatment and support for all mental health issues is important for the mother, as the baby's health and development is totally dependent on the mother's happiness. So all new mothers should be encouraged to be open about their feelings and fears with regards to motherhood. Regular exercise and good diet will definitely help aid recovery and prevent mental health issues. Let's raise awareness about mental health disorders during pregnancy and postpartum, as this issue may often be overlooked and sidelined by many. If you like this video, do hit the like button and subscribe to our YouTube channel. Share it with your friends and family, and do check out our Instagram and Facebook pages. Thank you.